Tell me everything you know
In 2 minutes or less.
in 2 minutes.
I know that there's more things I don't know than I do know.
Tell me about
About what?
heart attacks and overweight.
Okay, so there are usually signs and symptoms and conditions that indicate that you're a candidate for a heart attack, all right? So one of those is being obese, being overweight, being diabetic, if it's in your genes, if you have high blood pressure, high cholesterol, if you have a sedative job where you don't exercise very much, if you smoke, all those things are very, very predictive of having a heart attack, and they make you very susceptible to having a heart attack. So when someone that matches those characteristics comes to the emergency room, the first thing you think of is, wow, they're having a heart attack. And you have to put that number one, even if the EKG looks normal, even if you think that it's not, because chances are good that that person coming to the emergency room with chest pain, with sweating, with pain radiating to their shoulder, their jaw, anything like that, it truly is a heart attack. And it doesn't always show up on the EKG right away. Sometimes it takes a few hours, but there's an enzyme, troponin, that we check, and that starts becoming elevated after an hour or so, indicating heart damage to the muscles. So the first thing that any emergency doctor has to know is when someone comes to the emergency room with chest pain, they have to absolutely positively rule out several things. They have to rule out a heart attack, which is myocardial infarction. They have to rule out a dissecting aneurysm. They have to rule out pulmonary embolism, all those things that can cause severe chest pain. They cannot dismiss a patient that might have any one of those diseases. I call it a sentinel event. And that's something as an emergency room, you cannot forgive a doctor for missing that, because that is part of our core competency as emergency doctors, is that we have to know a chest pain could be a heart attack. Now that probability goes up, as I mentioned, exponentially with all these other features such as age, weight, high blood pressure, all those things. And so we've heard recently of a case that an ER doctor absolutely missed, a classical case that any first-year medical student would have known that this is a heart attack. Told her it was TMJ, that it was temporal-mandibular joint pain, and sent her home. And so she couldn't even walk to the car going home. She was so bad. They took her to another hospital, immediately put a stent in her for having total blockage of one of her arteries. So this just goes to show you what's happening in the world today of medicine. It's very embarrassing to me as a physician that they would have people of that kind of incompetence manning some of these emergency rooms today. There's no excuse for it.